IM injection procedure step-by-step intramuscular injection technique for nursing students. Intramuscular, IM, injections are one of the most frequently performed clinical procedures in nursing practice. They are used to administer medications directly into muscle tissue, where the medicine is absorbed efficiently because of the muscle's rich blood supply. For nursing students, learning the IM injection procedure is an important clinical skill that combines theoretical knowledge, patient communication, infection prevention, and professional responsibility. Every successful IM injection begins with careful preparation. Before administering any medication, the healthcare professional reviews the physician's prescription and verifies the patient's identity using approved identification methods. The medication name, prescribed dose, route of administration, expiration date, and documented allergies are checked carefully. These safety measures help reduce medication errors and ensure that the correct treatment is provided. Hand hygiene is one of the most important steps in infection prevention. The healthcare professional washes or sanitizes their hands thoroughly before handling equipment. All required supplies, including the prescribed medication, sterile syringe, appropriate needle, alcohol swabs, gloves, gauze, and an approved sharps disposal container, are prepared on a clean surface using aseptic technique. Good communication is an essential nursing skill. Before beginning the procedure, the nurse introduces themselves, explains why the medication is needed, describes what the patient may experience, and answers any questions. Clear communication helps reduce anxiety, builds trust, and encourages patient cooperation throughout the procedure. Respect for privacy and dignity should always be maintained. The patient is positioned comfortably according to the selected injection site. Healthcare professionals choose the appropriate IM injection site using accepted anatomical landmarks and current clinical guidelines. Site selection depends on several factors, including the patient's age, muscle development, body size, medication characteristics, and healthcare facility protocols. Students develop these assessment skills through classroom instruction, simulation laboratories, and supervised clinical experience. After identifying the injection site, the skin is cleaned with an approved antiseptic solution and allowed to dry completely. Throughout the procedure, sterile technique is maintained to reduce the risk of infection. The healthcare professional administers the medication according to evidence-based clinical protocols while observing the patient's comfort and response. Once the medication has been administered, the needle and syringe are immediately discarded into an approved sharps container without recapping. Proper disposal helps prevent accidental needle stick injuries and protects healthcare workers, patients, and environmental safe.